Welcome back to another episode. Actually, this is the first episode of Offbeat Orchard, still with Apples and Grapes Media. Today, we have another super special guest. Some would say probably the most special. We're joined by my mom, aka Michele. Thanks for being with us today.
Hi, thanks.
If you just want to tell people like where you're from and what you do now, and then we'll kind of backtrack from there.
I am from Lebanon County, mostly Annville, but currently in Hershey. I am a nurse practitioner.
Okay. Awesome. And then, so you grew up in Annville pretty much your whole life. You just want to tell us a little bit about your upbringing and just your childhood and stuff?
I was raised by a single mom. I have two sisters. Pretty much spent all of my childhood in the Annville area, and in actually this local area. I am the middle child. I mean, being raised by a single mom is challenging in that you don't feel like you ever probably get enough time because she's busy. So I was fortunate to have sisters to entertain my time,
Mm,
which is really, we spent a lot of time outside, a lot of time, you know, finding things to do to keep busy so mom could do what she needed to do.
hmm I remember you telling me a story once about like donuts every so often and you just carve them down. Could you tell us that story?
So we were not from a wealthy family, and so getting treats like donuts was not all that often. So when we went for donuts, there are exactly 12 donuts in a box, and there are three children, and we knew exactly how many donuts we would each get. And pretty much once we got them, they were gone by the time we got home.
Mm.
Our four donuts each.
Yeah, no, I think that paints a good picture of, how things were. And, even with siblings having to, some people like hide stuff or whatever. So you had to
Oh
scarf it
yeah.
down. But then, okay, but what age did you know you wanted to be a nurse? I know you told me before you kind of thought that early on.
Yeah, I was probably in the fourth grade. I was 9. I had some influences. We had I had an uncle that had rheumatic fever as a young teenager, so that did damage to his heart. He did not have a lot of medical options at that time when he was a kid. So by the age of 21, he was in congestive heart failure. His heart had been failing, and he would have been nowadays a candidate for a heart transplant, but that wasn't an option for him then. So pretty much he was like a hospice patient, but he lived with us. And I think I took on a nursing role with him and an interest then mostly.
Mm. Yeah, so I never knew that that's specifically kind of what sparked it for you. So that's good to learn. And then just going like through high school, like what was that like for you? Just like sports and friends, and everything like that.
I did play softball even from before high school. I played field hockey once I was able to, so that was a high school sport. I pretty much didn't fit into one single high school group. I kind of tried to be invisible and get along with everyone. So I
Mm.
had my sports friends, and then I had, um, you know, other groups academic wise. Um, but I wouldn't say that most of my way through high school I had any like stable group. It was always changing.
Yeah. And then just so your sisters, just for the people that don't know, like what is that age difference? Were you guys ever in school at the same time? Like what was that dynamic like?
We're all 2 years apart. So as far as the older sibling, she was very different. So even though we hit school around the same time, we definitely didn't know each other as we passed in the hallways on purpose. So pretty much I would have been in school with one sibling at a time. I don't think we were all three in the same area at once.
Mm. Okay. And then something happens your senior year. Um, so you get pregnant with my sister, Sam.
Mhm.
What was that like? How far along in the school year did that happen? And then just what was that like being, your thoughts on becoming a teen mom and everything at that time?
Well, I played softball, and I think that I was in a good position to be, having a successful senior year. And a lot of teachers and coaches knew me as playing softball. So that was really the first time that I had to admit anything was going on when I didn't sign up for softball. For a while, I made up excuses that I didn't want to play, but I really did want to play, but didn't want to jeopardize anything going on with me or my pregnancy. I had an episode in English class when I was a senior that I almost passed out because the seasons were changing and it was hot. And I had to have someone walk me to the nurse. So that was the first person I told. I was pretty quiet. Like I said, I wanted to be invisible in high school. We were raised by a single mom and didn't have a lot of money, and I didn't want to draw attention to myself. So I certainly didn't want to tell anyone that I was pregnant because that kind of had a connotation of um, not being successful or, doomed for, a life of struggle.
Mhm.
And I didn't want to carry that. So I probably had more questions the night of graduation from my peers about being pregnant because I didn't really talk about it. By that point, I was graduating and I didn't care what they thought. So I did answer a lot of questions, but I did graduate 5 months pregnant.
Mm, that's amazing. What were your overall like thoughts about, being pregnant? Like, do you have fears of being a teen mom? Were you excited? What were your thoughts and emotions?
Well, I had already applied to nursing school at that point. I guess I filled out the application, but I hadn't turned it in by the time I would have been due to turn it in. I already knew that I was pregnant. So um, I knew that that was off the table. So that was kind of scary. But there was no question that this was the life that I chose because it was, you know, my consequence of my own actions. And so I was going to make the best of it.
Mm, yeah. And then we'll just fast forward a little bit. So and then you start your nursing career just in the 4 years. Sam is 4 years older than me. So just kind of recap that 4 years between, when you have Sam, you start your career, and then until I'm born.
Well, I always said I did everything backwards.
Mhm.
So I did graduate high school, but became a mother and then became a wife and then became a nurse. So my career came after, but I always knew that it was going to happen. So in those 4 years, pretty much I decided that if I was going to have another baby, it should be done then. So that is when you were born. You threw me a curveball though by
Mm,
having some health issues. Um, so that delayed school a little bit more, but not by much. And I knew at that time that that was my goal ultimately. So whenever that happened, so we took care of what we needed to in your first year. So you were born in 94 and
mm,
I started nursing school in 96.
wow. And then just before the health stuff starts, like after I'm born, did you have any thoughts of any more kids?
No.
No, you even, regardless of the
No,
situation
you
before
were
that?
You were a lot of work, and, when I knew that I didn't wanna have any more children because I didn't know what was going to be entailed with your health concerns, and, even the doctors wouldn't let me make any permanent decisions about not having any more babies because of your health concerns, so I had to wait until you were a year old, for them to allow me to, decide on, not getting a tubal, not having any more babies.
Mm,
So, I think if I wouldn't have been so young, maybe I would have considered having more. It's just the way life rolled.
mm. Yeah, and then so from the time I'm born until, like, the first sickness or hospitalization, what's that time frame like? And then what was that actual thing that first started?
So, um, you were born 2 weeks early, and so by the time that I was actually due with you, we already knew that something was not right. Um, I'll never forget being a young mom and going to a doctor and saying, "I know something's not right," and they kinda make you feel like you're just a young mom and you don't really know what's like, you're being dramatic.
Yeah.
So the day that we found out that you were sick was we started out at a doctor appointment at like 9 or 10 in the morning, and we went for an ultrasound, and I felt like they didn't give me much respect because the doctor basically said, "There's something wrong with your baby. Now you have to go somewhere else." And that was kind of it. So
Mm,
when at 2 weeks old, we found out that your kidneys were too small and your bladder was too big, and they were giving it to us very much in layman's terms and sending us to the medical center for what ended up being your first surgery. So
mm,
2 weeks old. So
okay. What was that actual procedure?
they had to bring your bladder to the surface and create an opening because you weren't able to um, get the urine out normally because the urethra from your bladder to the outside was blocked and it was flowing the wrong way. So all the urine you were making was going back to your kidneys.
Yeah,
So to relieve that pressure, we had to open up a space to let you pee, basically.
yeah, and that actual thing is posterior urethral valve,
That's
correct?
the diagnosis that you were given,
Diagnosis.
yes.
Right, and then did they so have that first surgery, and then how long do you find out that it's, like, full-blown kidney failure? Do they know it's gonna be that right away, or
Yeah, they told one of your first doctors, actually was a lot to take at first, Dr. Wassner. He's very direct, but he had become such an important person to us.
Yeah.
But he was very straightforward. It was probably within that first hospitalization that he said, "Your kidneys are failing." He drew me nice pictures that showed me what things were supposed to look like and what yours look like. And you're 2 weeks old, and he's basically telling us that you're going to need a new kidney. So he couldn't give us time frames. So that was a lot to swallow. I
Mhm,
did a ton of research going to the library in the hospital. Of
yeah,
course, it's way over my head because I wasn't a nurse then,
mm,
but it was enough to arm me with the ability to ask questions.
yeah,
So,
yeah, and then, so just beginning the transplant process, looking for a donor, what's that look like? How long you start the process looking for somebody, and then how long until I'm transplanted, but then explain the process from the beginning stages.
so we knew you were going to need transplanted, but there's guidelines as far as you have to, which sounds kind of horrible, get worse before you can be made better.
Mm,
So, although we knew at 2 weeks old you were going to need a kidney, you weren't transplanted until you were 21 months old.
mm,
So, backing up 3 months before that, you did finally fail enough to be considered for transplant, but that process alone takes some time. um, at that time, the science didn't quite catch up to the fact that you could have other people as a donor. So your dad and I didn't have the same blood type, which was just a minor factor in it.
mm,
But when we realized that your aunt or my sister was at least the same blood type, the workup alone took um, a few months and then to get it scheduled. So there was a 3 month period of time where we did a lot of work at home, feeding tubes and peritoneal dialysis and medications as if you were more like an 80-year-old.
mm.
So that was a very, very busy time. And I wasn't in a profession that I could take off work. So we did this with a lot of family support and in between working full time, basically.
Yeah, and then so it comes to, like, transplant day, uh, like you said, it's 96, February 13th, 1996, I was 21 months old, right?
Mhm.
Or yeah, okay, and then, so just what's that transplant day? How are you feeling that morning, everything like that? And then just talk about the recovery process a little bit.
So the day itself is a little blurry because it started out very early. And, not only did I have you going into surgery, but I also had a sister who was going to be going into surgery, and all of which for both of you has tons of risks. And so that day was just very long and, um, waiting. We got to sit in the ICU because post transplant kids went to the ICU. Well, I guess all people go to the ICU.
Mm,
Um, and we had, because you would be so immune compromised, we had to wear full um, gowns, gloves, and all of that. So even when you came back, it being very sleepy, we couldn't hold you or do any of that right away. And at the same time, I had a sister who was going to a regular medical floor.
mm,
And at least in the ICU, you had a big team. She had she was one of somebody's 6 patients. So that whole day, even by midnight, she was having issues, so she was calling. So it was just a very long day,
Yeah.
but, we do have some video of you that day, and you were very groggy, but you had, good color, and it was just amazing to see the
Mhm.
difference.
Yeah. And then, so you're going through all this, like you said, you start nursing school, uh, at what point?
Well, registered and did all that in the end of '96, but my classes started in '97.
Yeah. So
So you would have been almost a year out.
yeah, so you're still going through all that, and it's still, I'm sure a lot of it's up in the air, and you're worried about, how it's only a year out.
Mhm,
It's not that long, but you're starting school. So
mhm.
I just want to keep bouncing from sort of personal to like career path. So what's it like
Mhm.
going through school, dealing with all that? You have Sam, who's how old at that point?
Just 5, yeah.
You have a 5-year-old.
Yeah, it was very busy, like, even though you were, a year old, you were still very immune compromised. So I remember it was, like, March of '97, I had been in towards the end of my semester, and you got the chicken pox and had to be hospitalized. And I was supposed to go to an awards like banquet or something. And I told them I couldn't. I missed a bunch of classes. Couldn't go to that. But my professors knew that I was getting a scholarship.
Oh,
Um, so they didn't want me to miss it. So they offered to come and sit with you so that I could go to that. Of course, we didn't need them to. We had family, but it was kind of like a good and a bad all in the same day.
yeah. And then at what point do you actually begin working as a nurse?
It was in 2000.
Mhm.
So my first job was in an intermediate intensive care unit,
Mm.
night shift.
Oh my gosh. And then just how do you think your experiences dealing with me up to that point and then starting with your career, how do you are you always drawing back on what I'm going through? How do you think it helped you or
I think that dealing with the environment of when you were in the hospital made me not as afraid to be in that environment as a new nurse.
Mm,
And I think you had a lot of hospitalizations before you were 2. You were in the hospital 24 times for admissions. So um, seeing you from very sick to just a minor admission helped me also, I think, not be afraid of very sick in my patients because I'd seen across the spectrum of very sick and getting better.
mm,
Um, and I wasn't afraid to interact, I think, with the doctors, which a lot of new nurses, have an issue with talking to doctors.
mm.
So it definitely helped.
Yeah, I think that, I mean, not to jump forward, but it's been like a through line. Your style as a nurse is very adamant, and that's kind of nice to see where that comes from in a way.
Mhm. Yeah.
But nice to reflect on that. But could you just share that one story of Dr. Wassner? The one I think he grabbed me from you or something like
Mhm.
that.
Yeah, the nurses weren't real crazy about Dr. Wassner's techniques, but he was also this was 20 years ago. You were very sick, and we had taken you to the hospital, and they had gotten you into a regular med surge um, room, and I was exhausted. He could tell I was exhausted. And he just took you from me. And then he realized how sick you had been, and he just walked you down the hall to the ICU without any planning. It gave me a respect for him. I
Mhm,
mean, he had already gained my respect to that point, but he really gained my respect as a physician, and that he was very much aware
yeah,
of um, my feelings as a parent and how sick you were.
yeah. So you learn there was kind of a method to his madness or his
Yes,
ways,
and
and
that
we
he
later
cared.
learned, yeah. Oh, of course. And we later learned he was a cab driver in New York City for a while. So that
Mhm.
explains a little bit of his story also. Um, but yeah, so then just fast forward, I'm going through all that and I'm a few years out and then I start kindergarten and I start grade school. Would you say I'm relatively healthy at that point or
Yeah.
normal, so to speak?
I would say the last surgery that you had as like before school was when you were 4. They had just been able to update some of the things they did with the connections of the kidney and the ureters. So you had that surgery at 4, but then pretty much you didn't have a single hospitalization through your school age time and even after you graduated.
Yeah.
I mean, yeah, you would have had nothing through that whole time. So it was like having a normal kid other than having to make sure that you took medicine, so the challenge only came when you went to college.
Right, yeah. Many years later, but so it's funny because I think about it and without, having ever been told these stories and stuff like that, it's like if you start out with my story as like my childhood, and if you ask me about it, I'd say it was amazing. We
Mhm,
had a really good family life and
mhm,
stuff like that and vacations and all that. So I start from that point, without
mhm,
even any recollection of this stuff.
mhm,
Until, I experienced it myself later on. Back to your career then at that point. So if I just fast forward like 2005-ish,
mhm.
like, mid like early 2010s, like where are you? Like what department? What's your nursing stuff look like early 2000s?
Well, I did the, intermediate intensive care for just a year or 2, and which I think that really actually gave me a really good foundation, but my love was emergency medicine, so most of my career was in the emergency room.
Mhm,
Um, I guess I don't like to think of myself as an adrenaline junkie, but I guess that is kind of what kind of people, nurses are drawn to that environment. I like to think of it as I've already had a high stress life or situation, and so I felt like I could handle that, and I just loved it. So I've worked in several different emergency rooms. So in that time period, I went from, a Lancaster hospital to Hershey.
mhm,
And that changes the degree of the patients and the acuity of the patients that I took care of too.
mhm. Um, and then so you're doing like emergency stuff for how many years do you do that role?
Um,
Mhm.
probably, um, I don't know, maybe 10, 12, probably 12 years
Yeah, so
or
that's a big
more.
chunk of your time. And then
Mhm.
just, back to personal stuff, like how would you describe me and Sam as like, kids, like, and like young teens and stuff like that? Just how would you describe both your kids?
I mean, I would think pretty typical. I've always enjoyed kids up to like age 7, and
Yeah.
then that 7 to 11, the growth and development, and you both were very typical in that, just very you know it all.
Mhm,
But my favorite time starts when you were like, 12 and 13 when you're coming into your own. And I used to always tell you, at this point, your decisions that you make affect you more than they affect me.
mhm,
And so watching that time period, I never felt that the teenage years were any worse. I just felt like it was what I expected.
mhm,
And so I tried to keep you guys as close as possible by getting involved in doing things with your friends and doing things that kept you where I could see you, but you could still do your thing. And I laugh when I hear you guys talk about things I don't know because as a parent, I don't think you should know everything. It allowed you guys to grow, and I just had the job of making sure you were safe. And I
yeah,
feel like you were safe.
yeah, and it's more fun now to hear it later when it's not as, like, serious and everything like that.
Mhm.
So, let's fast forward to, like, 2015 is a very crucial year in your life. So you start a new role career-wise. First of all, if you could just explain that,
Mhm.
and what is that role
Mhm.
exactly?
It was a new role that was created by the hospital to help support nursing. So there's always a little bit of a disconnect between physicians and nursing because of basically their role and their responsibilities. So this role was created as a support role because it was new. It left a lot of opportunity for the hospital to change it and mold it. Initially, we were um, the person who the nurses could call if they needed help or if they were struggling with trying to figure out what was going on with the patient, if they felt the patient was going downhill and the doctor wasn't listening,
Mm,
or they just needed some extra eyes to make sure that they were deciding the right thing.
mm,
The role kind of morphed into a code team response. We were doing that from the beginning, but it wasn't formalized. And then we became the team that went to all of the hospital emergencies. We were the only team that went throughout the whole complex. So, to the outpatient clinics that were attached to the building, no other team went to all of those places. So, we were a consistent set of eyes and we got a great feeling for what was going on in the in the whole hospital and its annex. But that also, for me, that role gave us I felt very appreciated in that role. We got a lot of respect from the nurses. And once the physicians understood that our role wasn't to step on their toes, but to help support the
Mm,
patients that they were taking care of, and our role also extended higher level of care outside of the intensive care unit. So they like that. So, in my time there, we got a lot of respect from the physicians to the point that they were calling us to go check on their patients.
mm,
Um, but it was high stress and it was a time that I could learn, but I had to learn independently. So if you imagine having a specialty where you know one thing really well, and then you have to know a little bit of everything everywhere in order to be able to do that and function, we spent um, a lot of time looking up patient diagnoses that we never heard of or being able to trend how patients reacted to things. So it was a huge growth opportunity for me in my career.
mm.
My colleagues in that role, I think combined, we all had, 20 years or more experience so that we were able to use each other because we came in from different areas to help us learn.
Yeah. It sounds like, um, you were really able to utilize, like, kinda everything you learned
Mhm.
up until that point.
It was as much as it was the ability to use what I learned, it was a huge point of growth too.
Yeah,
So I got to see what I didn't know, but it gave me the opportunity to go find out.
yeah,
And we took care of some of the sickest of the sick, which was, pretty incredible.
yeah. Do you have, like, any specific story that kinda resonates with you from that, your time in that role?
Um, I feel like there's so many stories. I
Yeah,
mean, you know, we my role went from things as simple as helping an ICU pediatric nurse get a trauma who needed a bath because they were covered in blood, being able to do that simple role because that's what the nurse needed, to going to finding a patient who's sitting on the bed talking to a family member and the family member thinks they're sleeping but they were in a full cardiac arrest.
mhm.
That's how extreme that role was.
Okay, and then also back to the personal life at that point, so you start that role, I think you said May 2015,
Mhm.
and then October 2015, we're blessed with my awesome nephew, and you get your first and still only grandbaby.
Yeah.
Maybe not what we, like, thought was the ideal time.
Mhm.
Sister was not maybe in the best place at that point, but what were your thoughts and emotions, like, when she was pregnant, and then just once he's born, how are you feeling becoming a grandma?
Um, I mean, my biggest fear was that your sister wasn't in a position to be ready for the responsibility of that. And, my first response was, I'm not gonna, raise another baby at this age. But I think going through the pregnancy gave us a chance to get used to having the little guy around, which I wasn't opposed to a baby at that time for sure, because I had had you guys so young. There hadn't been any little ones. And at that point, my career was stable.
Mm.
So when he came into the world, it was exciting.
To tie back in where I'm at this point, I'm in
Mhm.
college. Um, like you
Ugh.
mentioned earlier, probably just wasting my time, wasting a lot of money, everything like that. But I just remember being nervous and everything like that because it wasn't, maybe the best of circumstances. But I'm only away at school for a year, and then I come back in spring of 2015. But yeah, so I'm there for a few months until he's born. Just being a crazy time. And then, so at what point do you start your nurse practitioner schooling?
Um, Honestly, I had always thought that I would want to be a nurse practitioner, and as time things with you guys growing up, I didn't know if I was gonna do that, and
Mm,
then we got a pandemic, and if we're going to be stuck inside, I mean, I applied before that. I guess I should back up a little bit.
mm,
I figured that I was getting close to a big birthday,
mm,
and if I was going to continue my education, my personal goal was to have it finished by then. And so I applied, and I only applied to one school, and I usually don't, you know, believe in small miracles,
Mm,
but I thought that if it was meant to be, I would get into the school of my choice, which I did. Then I was terrified. Um, and it turned out then the pandemic hit. I started school in January of 2020.
mm,
And of course, we were deemed a pandemic by the March of that year. And being shut down, I think I'm not a nervous person. I'm pretty calm, I think, for the most part. But the pandemic, I think, had everyone very anxious, and school was a good diversion for me, a good focus. Um, and because it was a 2-year program, that pretty much took um, that time, to be locked in and focused. So I finished classes in December of 2021.
mm,
So I guess 19 to maybe started in 19. So it was 19. Sorry, COVID-19. Yeah. I
yeah,
actually started school in January of 19.
yeah. So not only COVID, but then like our timelines are going to overlap a little bit, but backtracking just slightly, 2019 is when I get sick again.
Right.
And after the transplanted kidney that lasted just shy of 23 years finally fails, whatever winter, and then till we go, it's January 2019. But you're dealing with now school, a pandemic, and me being sick, still living with you and everything like that. Just how are you getting through all those elements and still working?
I don't know. It was super, like I said, I'm usually calm, but I did feel unsettled. I mean, I was also building a house. So between, or thinking of building the house at that point, I guess the house came within that year. But you being sick, was a huge unexpected, um, piece of it. And so getting used to you as an adult in a sick and me parenting a child in an adult role who is sick is was different
Mm,
because at least when you were a baby and sick, I could take care of everything and know that it was being met, and I could um, you know know that everything was under control.
mm,
But you being adult needed to be able to handle your health care and your needs, and you know in dealing with it, it was different because of your age, and you should have been doing things that were typical of a 25-year-old. And so it was, that first year was like crazy.
yeah. Yeah, I mean, when I was a baby, it's like I just kind of, for me, it feels like I just kind of got passed through this time and everything was handled. But I
Mhm.
was probably crying a lot more back then. But now, as an adult, I had, emotions,
Mhm.
like everything I was dealing with too. And like,
Mhm.
so you never had to deal with me speaking how I felt on anything like that, or
Mhm.
just like any gripes of like a young angst
Mhm.
of a young, adult anyway. So there's
Mhm.
all that mixed in with it. Um, but then, so when do you start the position as a nurse practitioner?
I actually started, I think I messed up the timeline a little. You got sick in 19, but my classes started in January of 20. So that first year was crazy, mostly with you. The second year got crazy with you being sick still, starting school, and then building a house. But I finished at the end of 2021 and started my first nurse practitioner job in March of 22.
Yeah, and then just in the beginning, starting a new role again. Um, what's that like? Not like it's hard enough for people to start, over in a sense when they're 20s, 30s, like
Hmm.
you're, an adult, and then what's that like just starting a new role at that point in life, especially with everything else going on?
I mean, I think anybody who is at the top of their abilities in a career. So, as a nurse resource man, I had that down. I could go to something and I could know exactly what I was doing, why I was doing it. And then I start a new position, which is still nursing, but it's from a different perspective. Now I'm responsible for telling other people what I need them to do for the patient instead of being the person that does it. And it's terrifying because now you're increased legal responsibility for your choices. And you're also responsible for whether that person gets better or not to a degree.
Yeah.
Um, and I was in a different environment because all of my career had been inside of a hospital.
Hmm.
And so this was the first role that I was in an outpatient setting.
Hmm.
And that alone was different
Yeah.
in the sense of in the hospital, I saw very sick or people that were in immediate crisis that was more life threatening than the outpatient world. So my thinking when I approached my patients had to be so different because these are people that were more well than
Yeah.
what I was used to.
Hmm.
So it takes, I mean, I feel like even this far into it, I'm not at my prime in this role.
Yeah. Now you're still relatively new, and then just for the people that don't know, like, your day to day, so you work in just an outpatient urgent care, you see,
Hmm.
your own patients,
Hmm.
just what your day to day, describe that just for people that don't know what that
Um,
means.
Mostly in the state of healthcare the way it is now, people are having a lot of trouble establishing family doctors. And so we're seeing a lot of things that um, you maybe would go to your family doctor for years ago, but you can't get in. So respiratory stuff, testing, the acuity in the urgent care has gone up a little bit because people that have a lot of issues can't get into their family doctors, but they need medicine or they need treatment or they need direction. And there's been a big public push not to utilize emergency rooms for things that aren't real severe because you'll wait 5 hours. And so an urgent care is kind of the middle of the line, but we do get patients that should be in the emergency room and they maybe just need someone to say, yes, it's okay for you to go to the emergency room. You have a problem that needs emergent care.
Right. Yeah. Yeah, it's hard to know that balance probably for some people because obviously
Mhm.
you don't want to go to the ER for, cut
Mhm.
your finger necessarily. I mean, you
Mhm.
might, but urgent care can do that just as well.
Mhm.
But, and then just back to the personal stuff. So you're in that role for like a year or so. And then just, so I was on dialysis for 4 years before being transplanted for the second time, compared to what, like the month and a half
Three
or
months.
three
Yeah.
months the first
Mhm.
time. What was it like just for you enduring from your perspective, my 4 years on dialysis, all the stuff, me learning about it as I went, just the extra things I don't think people realize, like catheter
Mhm.
infections and then different
Mhm.
procedures, fistula stuff, like a boatload of procedures and hospitalizations for people, like things people don't even,
Right.
understand. Just what, from your perspective, that whole span, what was
Mhm.
that like for you compared to the first time?
Well, I think the first time there was an endpoint because we were using a family member. And so that timeline was finite. We knew that February 13th, that was going to change how things were happening. With this time, because we didn't have that option of using a family member right away, um, it was like an endless you didn't know, uncertainty, I guess. And, if you remember a year prior to transplant, we had a call that, got us both very excited that we were going to have this process end and then the disappointment. So the emotions with every single thing. So that first year, the emotion came from trying to stabilize you. And I don't even remember at this point how many hospitalizations and how many ICU stays that you had. And then that year, the most severe episode where you lost your vision and had a seizure, with just me and the grandbaby at home was terrifying, even as a nurse.
Mhm.
And so knowing that at any point, you could have an episode that wouldn't have a good outcome. And that was always a possibility. So getting through the process without knowing when the end would be was very stressful, I know for you and for us, because it truly is a village when someone has chronic illness.
Yeah, it's like even for me, and I'm sure the people around me had faith that the transplant would come. It's the
Right,
uncertainty of when or how or who or
right,
where. There was a lot of time we didn't even know where.
right.
But I just want to rewind to that day that I did lose all my vision, just from your perspective, because I've told the stories a few times. But can you just describe that day for people? That was probably the worst, or like what I would say like the best story I have, but the worst, day probably during that time
Mhm.
period. Could you just describe that for people?
I just remember it being early and you had gotten up in the morning, but you'd come upstairs and told me you couldn't see. And so I'm thinking like you made it all the way up the steps and you found me. And so how can you not see?
Yeah,
Um,
yeah,
and then when you explained that everything was black, I remember that we called the ambulance. Um, but I don't think that they had a sense of urgency because I think they probably heard the same thing that I heard. How can you possibly just all of a sudden not see? Is that really true?
yeah,
But I remember the first person to come was like a more of a police officer who carried medical equipment, but interestingly, I don't think knows how to truly use that medical equipment.
yeah.
So
Probably
I
not.
remember going downstairs and getting, I don't know, clothes or something for you. And all I hear is somebody, that the person saying, buddy, are you okay? And that's all I need to hear as a nurse. When someone's saying something like that, you know that someone is unconscious. And
Yeah,
so when I came up, you had been in a full blown seizure and purple. And I kind of think that my nursing part goes out the window a little bit because now I'm in mother mode. So I have this equipment that I feel like I'm fumbling through, but when you're with someone who doesn't know how to use the equipment, but I have the knowledge to use the equipment, I felt like I needed to. So, bagging you and trying to be nurse and be mom at the same time was awful.
mhm,
You're, and, having a little one in the house and not knowing if he's going to wake up to this. Um, so the police officer had called back into 911 and increased the acuity, urgency, I guess, for the ambulance to get there.
yeah,
But once I sent you in the ambulance, I pretty much had to take care of getting the little guy somewhere before I could even know what was going on with you.
yeah.
It's a very scary time.
Yeah, I mean, timeline wise, it gets scrambled for me too, so that's why I often like ask
Hmm.
other people too. But like, so what year even was that? Was that 2020 then,
No, it
or
was 2019
oh, it's
still.
2019
It was
still?
when we were trying to stabilize your blood pressure. So,
Yeah. Oh yeah. So
what
for the
they
people that
called
don't
that,
know, what caused
yeah,
that eventually
was the
was
hypertension. Yep.
what I think they said in the hospital, like the highest it was like 250 over 180.
Yeah.
Um, they
It
said I
was
was like,
dangerously high.
yeah. For people that don't know, what's like a normal blood pressure or like a high blood pressure normal is what?
So 140 over 80 is, the highest normal
Yeah.
these days. So, I mean, the fact that you had a seizure, it was directly reflective on the fact that your blood pressure was so high.
Yeah.
And what that ended up resulting in is damage to the back of your brain, temporary damage to the back of your brain, which is why your body was resetting itself by seizing and shutting down.
Yeah. Yeah, that was an insane day just because most I don't remember. I remember up to a certain point and then
Right.
nothing after that. But yeah, so just as an example of some of the stuff during that time period, that's one story. So for the people that don't know, I struggled to find like a direct match. I didn't have too many people being worked up anyhow. So figured I'd be part of this paired exchange program, which later turns out is how I do receive my second kidney. So we do eventually get that call. And then um, my mom turns out to be the one that is in the paired exchange program. She was able to give to somebody that needed a kidney, and the person that was willing to give for them gave to me in exchange. Um, but what was that moment like for you? That was that like, I know you had a couple surgeries and stuff. Was that like your most major procedure, you would say? The nephrectomy?
Yeah, other than having you guys, I had never been in the hospital overnight until then.
Oh wow. Oh my gosh. So just what are your thoughts like leading up to it? Of course, you're like you're gonna do it because for me or whatever, and to help
Right.
this other person. But then like getting closer to the day, are you nervous? Are you just excited? How are you feeling about having this, for me and for you?
Um, yeah, nervous, but I think um mostly because I, am older than um some people that probably go into the program. I mean, I know that I'm not that old and they do accept even older donors, But for me personally, I felt like, um, first of all, is my kidney going to be good enough to give to somebody? Is it going to take? And then for me too, like I'm used to being healthy. And so I didn't really know what to expect. That was a big surgery to figure out how things were going to be okay. Um, just to make sure my body would take well.
Yeah.
Um, but the workup that was having to go on every year up to that point was probably worse than the actual surgery and the post period because every year I had to go in for invasive blood work and invasive testing and making sure that all of my wellness stuff was up to date or I would lose being a candidate.
Mm.
So I think the workups every year was kind of more the mental challenge.
Oh, okay, that's interesting. I wouldn't think that necessarily, but it's also during a time where there's other mental, like, uncertainties too, so that
Mhm.
probably
Yeah.
compounds. But then I get the transplant, and then at this point, I have Antonia and such a strong support system with you, and Dana, even Sam, and her husband Nick. But then what was like recovery for you? Did you expect it to be kind of as tough as it was? I feel like of course, had the transplant as a baby. I had no idea of any of this stuff.
Mhm.
So I'm only realizing it this second time around for you, for me too, but really going through it. But what
Mhm.
was recovery like for you? And then from your perspective, my recovery.
Um, I mean, being in the hospital, I think was, um, I didn't know what to expect, but then I ended up staying a day extra because I wasn't counting on being as down and out as I probably was.
Mm,
Um, plus, I was still worried about you and they wouldn't let me see you because they
mm,
wouldn't let me leave my room, to go off the floor. So, um, I'm trying to kind of heal a little bit or try to deal with that, but I was really also concerned that I still felt like I needed to be your person, even though we do have a village.
yeah.
Um, so I do think that you getting a kidney was probably you bet and you're younger, an
Mm,
easier bounce back. So
yeah.
I felt a little surprised by not being able to bounce back like maybe I thought I could. And I still did normally bounce back. I just had higher expectations, I guess, for myself.
Mm,
But the recovery I think was fine. I think it was a relief mostly to see how well you did. I mean, you being in the hospital only, I think 1 day more than me was like amazing. You just
yeah.
had a huge surgery longer than me
Mm,
and, some more challenges for your surgeon and you made it out of the hospital in one extra day.
yeah. I don't think I gave him much of a choice, but everything's great as far as my health stuff, and you're back to work and all that.
Mhm.
Do you have like any more career goals?
I don't think so. The only thing
Accomplished
that
a lot.
would the only thing that would change would be my environment. The um decision to go back to what I love, being emergency room, or just specializing into one thing so that I can be on the top of my game in one area is kind of appealing. Um, but then the emergency room again is that energy and stuff that I've always thrived on.
Yeah.
But at this point in my career, I feel like my work life balance priorities have changed. And, you're only put on this earth for a finite amount of time. And I think we're put on earth to be with our humans, and work is enough to pay my bills and do those things. But my priority is to be present.
Mm. That's a beautiful segue because where I was gonna go next was just when you're not working, just what do you like to do besides I know you like travel and to host and stuff like that. What do you enjoy just doing outside of work?
Um, I mean, I love party party planning or hosting.
Mm,
Um, I love to read when I get a chance, but then I get on a roll and then I can't do anything but sit and read. So I have to take a break sometimes.
yeah.
Traveling is huge. I realize how small we are in this world. And so when I think you grow as a person when you travel and
Mm,
you can appreciate first of all, being in situations where you're around a lot of people, so travel alone
mm,
gives you some patience, and then seeing things that are outside of your box totally changes who you are.
yeah.
And I think I would traveling is become a higher priority, and, I did a lot without you guys because we didn't travel as much when you guys were kids, but now I just want you guys to see everything I see.
Yeah. No, I think you deserve it at this point. Where's one place, that you wanna go to that you've never been?
Um, there's so many. I
Yeah,
mean, I wanna go to Europe. I haven't been to Europe, so I would like to do kind of a brush up in a lot of different places in Europe.
yeah,
Um, Probably those are the biggest. I mean, there's places in the United States that I would like to see too that maybe aren't, as grand, but they're places that this is something I should do when I live here.
yeah. And then just before I let you go, just what advice will you give, well, two-part question. What advice would you give to any young nurse just starting their career?
Mhm.
That's the first one.
Um, sorry.
Okay.
Um, I would, just have them not get discouraged by the overall system they work under and keep focused on why they're doing what they're doing and know that they are making a difference. And even if it's just to one family, that is huge to them.
Mm,
So I think keeping your focus on why you're doing what you're doing and know that you are impacting someone in a good way or a bad way just based on how you take care of them.
mm. Yeah, I think that's important to remember. And then just the last question, if you can write a letter to 18-year-old self, what's that look like?
I think maybe take more advantage of opportunity and not be focused on the next step all the time, but focus on the benefits around you at each step. Um, I mean, and just kind of enjoy it.
Yeah. All right. I think no, that's all I have for you. That was
Okay.
amazing. Thank you for being the first guest for Offbeat Orchard. I really appreciate that. It's just a way for us to interview people, outside of the norm. The wrestling
Mhm.
and combat sports is cool, but I like talking to interesting people in general. So